Welcome back to the Rick Smith Show. Now, here is Rick Smith.
I gotta tell you, I'm sure glad that we've got Senator Ron Johnson from Wisconsin, the Republican, who today had a hearing on alternative medicines. While Trump is having his vaccine summit, which nobody really understands what he was doing or what executive order he actually signed. He signed something. Nobody seems to know what it was, but he took credit for it, whatever it was. But you got Ron Johnson going, well, maybe we need to be talking about alternative medicines. And right away, I'm thinking, the silver stuff, that's coming back, hydroxychloroquine, I'm sure that's coming back. And they did. And they brought up a whole bunch of other stuff used for, all kinds of bizarre ailments as the super cures. And I'm going, can we just get the vaccine? Can we get rid of all of you witch doctors and poison potion folks? Can we do a little bit of that and actually get some, medicine and maybe be able to, pay for it? Make sure that people can get the care they need when they need and not go broke. And here to share some thoughts on maybe how we get to that point, or at least from the short term, I've asked Laura Packard to come talk with us. She's a stage 4 cancer survivor and the founder of Healthcare Voices. Laura, thanks for taking time for us.
Thank you for having me.
So what do you think? Snake oil, can we go back to leeches? Maybe leeches would help with coronavirus. What do you think?
I think thoughts and prayers is not a COVID-19 pandemic strategy. And I think that alternative medicine should be filed along with alternative facts.
I'm right there with you. And, the sad reality is, and this is one of those sad moments. I have a relative who passed recently because of the coronavirus. And sadly, he was a big Trump supporter. And it was just one of these horrible moments where, he was an older gentleman. And, it's just one of those things where, if we could just find some middle of the road kind of fact stuff, I'm right there with you. It's crazy. So here we are, days away from the end of open enrollment. Tell me about it.
Well, open enrollment is going on right now through Tuesday, December 15th in most states. Some states have extensions and run a little longer, but the important date is Tuesday, December 15th, and you can start shopping for health insurance at healthcare.gov. And even if there is a separate state exchange for your state, healthcare.gov will route you to the right place.
Yeah, now Pennsylvania is the state that expanded Medicaid, and you can go to healthcare.gov and it will take you to the Pennsylvania state site. And there are still a number, not as many as there used to be, but a number of navigators that can help you get through the process and make sure that you're doing the right stuff. And we're in this moment where you have an administration who is dead set against the Affordable Care Act, or the dreaded Obamacare, because they are the same, folks. I know it's hard to believe, but they are the same. And they've done virtually nothing, in my view, to promote the fact that the open enrollment period is happening and to help people get the insurance that they need when we've had so many people lose their jobs and ultimately lose their insurance.
Exactly. And the money that we're paying for, part of the premiums for your Affordable Care Act plan was to go to marketing to help spread the word about this. And so they've cut the marketing budget. They've done everything they can to sabotage the Affordable Care Act, but it's still here and we're still here too.
Yeah, even though there's still that Supreme Court case that's still lingering, although I feel a little bit better, maybe not a lot. I'm not optimistic. I'm not bright and sunny, but I'm feeling a little better than I was before I heard some of the questioning. Have you followed the case?
Yes, and it's a little difficult to tell how they're going to vote because sometimes they'll do devil's advocate and they'll ask questions that don't necessarily determine how they're going to rule. But the important part is that the Supreme Court ruling will happen next spring or maybe next summer. So that is several months away. And if you don't have health insurance, you should go to healthcare.gov now and get covered.
Now, there's a lot of people I know, and I've spoken to a number of people over the last several years who, literally the Affordable Care Act has been a lifesaver. And, you have an interesting story as well, right?
Mm-hmm. The Affordable Care Act saved my life. About 3 years ago, I walked into a doctor's office with a nagging cough and walked out with a stage 4 cancer diagnosis. And I never could have been able to afford the treatment that I needed to be in remission today without good insurance through the Affordable Care Act. I'm self employed, and before the Affordable Care Act, I had junk insurance. If I still had a junk insurance policy today, I would be bankrupt or dead.
And, sadly, Trump has brought that junk insurance back. These short-term plans that, you get a nice slick brochure and a nice card to put in your wallet, but it doesn't cover much. What we used to call catastrophic plans. And even then, they still don't cover anything.
Exactly. So if you are working with a broker, make sure that they are showing you all of your options, and you can backstop that by going to healthcare.gov yourself and doing the shopping. There are some brokers that are great. I work with somebody here in Colorado that he helps talk me through all my options and the best policies for my situation. But not all brokers will do that. And so just make sure that the policies you're looking at go beyond just the initial sticker price, and make sure that they have the coverage that you're going to need.
Now, see, this is one of those crazy moments where I'm sorry, I don't know that I want to be in a position where I have to, give up one thing for another, and I want to, which plan is specifically tailored to my needs right now, because my needs may change tomorrow. Now, I'm fortunate. I have probably the best healthcare coverage any person in this country can have at this moment. I've got good Teamster Union insurance. When I got my hip replaced, it cost me $130 out of pocket. That's it. I didn't worry about the insurance. I didn't worry about if it was covered. I didn't worry about any of that. I worried about getting well. And I want that for everyone. And while the Affordable Care Act and the policies in there have some problems, it's still a step in the right direction to getting us the kind of care we need, so we don't go, well, I don't really have cancer as a family history, but heart disease I should cover. It makes no sense to me. You should get coverage. You should be protected. And if you get sick in the wealthiest country in the history of civilization at its wealthiest moment, you should get the care you need.
Exactly. And nobody knows what's going to happen tomorrow. And of the millions of Americans going through COVID-19 right now, nobody knows what kind of long-term effects they're going to have and what kind of care they or you or I are going to need in the future. So everybody needs health insurance. And I wish that our elected officials were working on making healthcare more affordable and available to everybody, instead of spending their time sniping at the Affordable Care Act and trying to take away what little healthcare we have.
I mean, those years should have been, the years of the Obama term and into the Trump years should have been tweaking it, making it better, making it more affordable, doing some of the things that I agree with the conservatives on, things that should be addressed. Surprise billing, something absolutely should be addressed. But we haven't done any of that stuff. So we've been kind of like stuck in time, stuck in 2010, and, sadly going backwards. Do you see a way forward?
Well, I am hopeful that President-elect Joe Biden has promised to make healthcare more available and affordable to everybody. I spoke with him at the Democratic National Convention. I was a part of the healthcare panel, and he promised us a public option. So I think we absolutely need to give those insurance companies some competition. But it all comes down to what happens next month in Georgia. We have got to elect pro-healthcare senators in Georgia, or else we're looking at Mitch McConnell's agenda. And we know what that is because we've just seen several years of it.
No, you're absolutely right. But, I look at your situation as someone who's self-employed, and I went through it myself when I was self-employed, having to find coverage somewhere. Unfortunately, we were able to get an ACA plan, and it was nowhere near the healthcare that I have now. And as I said, I want that for everyone. But it was that lifeline. Fortunately, we didn't need it. But if we did, thank goodness it was there. For me, this is one of the arguments I've always made. Get away from the employer-based healthcare system and get into a public option scenario, a national system, so that people like you, people like me, people like our listeners can grab that entrepreneurial spirit and run with their passions, run with what excites them to do, instead of showing up at a job because, well, I don't have a choice. I got to get the health insurance.
Exactly.
I love those answers. I love when I'm exactly right. Because, at the end of this is one of those moments where, we could do so much as a country and should be doing these kind of things. Now, part of what you do as the founder of Healthcare Voices is to amplify other people's voices. I'm curious, are there stories, and look, you've got a whopper of one. Are there stories that stick in your head? Do you go, wow, this is something that I should share? Any of those?
Sure. Well, I talk to people every day that have healthcare stories struggling through the broken healthcare system we have in this country. And one of my friends, Lauren, is a breast cancer survivor and a small business owner in Atlanta, Georgia. And so she's paying very close attention to this election. And it's people like Lauren that we need to vote for every chance we get, because if we're not paying enough attention, if we just reelect the same old people every time, they go to Washington, D.C., and then all they do is do things like attack the Affordable Care Act instead of moving us forward. So for Lauren and for me and for everybody out there that has pre-existing conditions or ever could have a pre-existing condition, we need to vote better people into office now.
And that's the message for Georgia. And that was the message, a couple of months ago. And that was the message, 4 years ago. That's been the message for a while. And I keep hoping at some point that we wake up to it. And maybe, and I keep putting a lot of hope in we, the American people, waking up from this pandemic and going, wow, we just lived through something really horrible. Let's make sure we don't have to do that again.
I would hope, but the fact that we're worst in the world on the pandemic, that we've lost more Americans than any other country has lost its people, and yet 70 million people voted for more of the same. So there's a disconnect there that for whatever reason, people see what's around them and what we're going through and either are denying that it's happening or deciding they want more of it.
It's absolutely crazy. So to wrap things up, healthcare.gov, sign up for the Affordable Care Act. There are plenty of plans there. It's not very hard, is it?
No, it can take a little bit of time because you might need to know your income from last year to figure out if you qualify for credits or not. But it's absolutely worth taking a few minutes to check it out. Even if in the past maybe you couldn't afford a plan, check it out this year and see. I know that the policies available to me actually dropped a little bit in price this year. So it's always worth at least taking the time to check out your options.
There you go. The website, healthcare.gov. Make sure you check that out. Only another week to go. Next Tuesday, I guess, the final day. But don't procrastinate. Do it soon. Laura, I appreciate you taking time for us.
Thank you.
Good stuff. Appreciate the time. Laura Packard, stage 4 cancer survivor, founder, Healthcare Voices. You can follow her on Twitter. We'll get links on how you can do that on our social media pages. Quick break. Right back. Stick around. You're listening to The Rick Smith Show. We're working people. Come to talk.